You're listening to Tusemezane Sasa podcast that is brought to you by Zamara Foundation, a feminist organization working towards reproductive justice. This space is going to be a space where we're going to have life-changing conversations around sex and sexuality and also the struggles of women. We're going to celebrate wins, but we're also going to talk about conversations that are deemed impossible, conversations around how the rise of anti-gender, anti-feminist, anti-nonsense groups that have come together to be able to bash issues around sexual reproductive health and rights. Welcome to this and join us in this journey of these life-changing conversations. I'm your host, Wamboy Kimani, and together with my other colleagues, I will bring you these conversations with Martha Kombe and Nancy Baraza. Welcome and keep listening and join us.
So buckle up, folks. It might be a little spicy, but we promise you a really exciting journey. Either way, it's going to be a vibe.
In this season, we are bringing you 10 powerful episodes where we'll be talking about feminist twins, feminist struggles, and the fight for sexual reproductive health and rights. In this season, we are going to unpack misinformation and disinformation while amplifying the intergenerational feminist leadership and feminist twins as well. So join us as we make the voices of African women and girls be heard through Tusemezane Sasa podcast. Hi, and welcome to another episode of Tusemezane Sasa podcast, where we host life-changing conversation. Today, we are going to have an amazing conversation about sexual reproductive health and rights as it relates to feminist movement. It's going to be an exciting conversation because our anchorage or the anchor of our work is around sexual reproductive health and rights justice for African women and girls in their diversities. And to drive this conversation, I'm joined by an amazing guest who will introduce herself, tell us what she does, and then we'll jump right into it. So welcome, Mwavishi.
Thank you, Nancy. And thank you. My name is Letitia Mwavishi. I am an advocate and I'm a feminist. I work at the Federation of Women Lawyers as a policy and advocacy officer leading the SRHR program. So I'm really excited to the conversations and looking forward to it.
Excellent. So thank you so much, Mwavishi, for just taking time to be here. I know with this work, we are extremely sometimes busy.
Yeah.
The challenges of even just being here and just getting an hour to be here, I generally do not take it for granted. So thank you so much for being here.
Thank you for having me.
And you look really nice. You look gorgeous.
Thank you. Thank
really
you.
Nice
Thank
to have
you.
Yes. So I think we'll just jump right into it in terms of course, there's a lot of things that are happening within the sexual reproductive health and rights space, from the cut in fundings to the rise of anti-rights movements to, people having burnout and things like that, which are related to sexual reproductive health and rights. So I'd like for you to just help us have this conversation around what you see are the sexual reproductive health and rights challenges in our time, especially as it relates to feminist organizing around sexual reproductive health and rights. Mm-hmm. So what would you say, or, from your experience working at FIDE and of course your lived experience as, of course, a young woman, what would you say are the SRHR challenges that are facing the feminist movements right now?
Thank you. And I think you've just started it off the conversation of funding, because we see, especially when the year started, the funding community or the development partners pulled out in terms of supporting sexual and reproductive health rights, a program or initiatives which really had an impact in affecting, of course, most people, and the key populations, especially the LGBTQI, were affected because this now translated to hospitals or service providers being limited in terms of providing those services because funding cuts off medicines or drugs, or even supporting the people to provide information for persons to be able to make informed choices. Mm-hmm. So some of course, what we are looking at is now the limiting in terms of people coming out to seek the services, because we see it will now translate in terms of people now either being targeted, especially now the key populations. We'll see the number of HIV cases, HIV and AIDS cases rising. We'll see access to safe and legal abortion being limited, or of course, people are going out to face that challenge. And of course, now you also mentioned the aspect of anti-rights movement, which are going to push back in terms of understanding and bringing issues around fetal rights. So we are seeing that the conversation will tend to push back in terms of the gains which have been made. But then, of course, we're also looking at the positive aspect of it, because you're seeing some laws are really making progress. We saw Rwanda making a tremendous change in terms of lowering the age of persons who can access sexual and reproductive health rights to 15, which is really a good impact, and especially in Africa, which we normally see it's a challenge when we see conversations around children being protected, their best interests being limited. But now when it comes to conversations around them accessing quality and comprehensive sexual and reproductive health rights, we tend to see that the laws are a bit restrictive. So for me, and where I'm sitting, I see it's a bit of a challenge that we shouldn't, as feminist movements, that we shouldn't be impacted heavily, but we should continue the work in terms of giving information, holding governments accountable, and looking towards empowering people to know their rights and to know how best they can access them, so that at least now we are not now leaving the gap or the void that has been left with funding. Yes, funding, it is a big challenge, but we tend to see that, like in Africa, there was a declaration which was the 15% Abuja Declaration to commit to health. That is something that as advocates, as feminists, that we can work towards to see now African-based development partners support especially health initiatives and sexual and reproductive health initiatives to ensure that young persons, young women, all persons in their diversities are not left out based on these challenges that we're facing.
Nice. Thank you so much, Mwabishi. And I hear what you're saying, especially with, the fact that we need not to now stop doing the work, that it continues, and that we just need to find ways or instruments, either within law or just within our organizing, things that we can leverage on to ensure that this work continues.
Yes.
The challenges will be there, but then we need to keep the momentum going, because this work it's part of our identity. It's part of who we are.
Yeah.
And just because, we have challenges with, funding cuts, the shrinking civic space, the rise of anti-rights movements, then it does not mean that we then tire from doing this work. And I like your emphasis around laws and instruments which are available within our country and, of course, across the region, that just helps us to continue to, have at least a bit of buy-in or, at least something to cling on to. So all hope is not lost. So even with these challenges, what I'm hearing from you is just a lot of hope in terms of what can we do rather than, all the challenges and, we are going through this and this, because of course we know the challenges. But then if we do not call ourselves to then solve or work towards these challenges, then it means that we'll just be lamenting feminists, and we don't want to do that or even be that. Yeah.
And just that's the point, because even if we look at how the movement, especially for me, I'm passionate about access to safe and legal abortion. When it started, even from the Roe versus Wade case up to now, for me, the positive impact that I'm seeing is people are talking about it. Of course, we have both negative and positive, but people are talking about it, and it's a lived reality that people are living. So for me, I'm hopeful because the conversation is alive, and we just have to give the oxygen to it so that it doesn't die by just mere challenges that we're facing day to day.
Yeah. And I just admire also the work that feminists or movements do, especially in regards to solving these challenges, because also I remember from the Pan-African conference as well, how feminists organize, and that will now lead me to the next question. So how do you think, grassroots movements, or both physically or digitally, are trying to, combat the challenges that the feminist movement is facing in regards to sexual reproductive health and rights? What are the things, or what are the trends that you've seen from your programming or your organizing around the law to influence access to sexual reproductive health and rights services, especially access to abortion, and of course queer rights? So what would you say, or what have you seen as the strategies or the things that grassroots movements, either physically or digitally, are doing, or the things that people are doing to just ensure that women and girls continue to enjoy their sexual reproductive health and rights?
One thing that I've seen positively, and I think it's working, it's the solidarity movement, the movement buildings, the movement coalitions of SRHR organizations or feminist organizations or feminist advocates just coming together to just build that coalition and having one voice. Because one thing, of course, that I've noticed, and it's something that is also visible, is the anti-rights are quite vocal. And once they say something, of course, they have that unison, which for us, I think there's that solidarity that we have empowered ourselves with.
Mm.
So at the level of the grassroots, of course, is to just build their capacity, give them that strengthening their engagements in terms of how to understand how best to navigate in terms of getting cases, referring them to the best place that they can get assistance, and supporting them where, of course, there's a gap.
Yeah.
So for me, that is one thing that you can strongly leverage on in terms of just building that solidarity and ensuring that you're not leaving anyone behind. Collective care is very important because a lot of times you're also seeing that even when the funding really dropped or was a big hit, some organizations had to close. But you can sense that the work that they were doing at the community was really impactful. So it's just to call out or come to stand out and hold their hands despite what has happened. And of course, just continue the conversations going. When we hear something that has been mentioned, like right now, we are hearing like in Kenya, the conversation around how the social health authority or the social health saga, the She and Sha conversations, we need to put our voices when such things happen. When budgets are being read, we need to air our concerns in terms of how it can be impacted in terms of enabling sexual and reproductive health rights. Right now, we're talking about the law. We currently have in place various laws that are being amended. So it's just to call out every person in their capacity. The digital space, digital advocacy has really taken that space in terms of just creating awareness for people to understand what are we really advocating for. It's not just for us to just have those laws in place, but for people to understand what does it mean for you to have a right to access an available, accessible, and quality care of reproductive health care, so that even if you walk into a facility and it's the bare minimum, what cause of action can you gain, and what are some of the steps that facilities can remedy or can adopt if it's, for example, gender affirming care. We push for such advocacy, and how best you can also do that is to support those who are also doing data collection, evidence-based research, thereabout. So that at least now when we are also coming together, it's more of just reflecting good practices that we can apply in our various spaces. Because even as you're also spreading the risk amongst us as feminist organizations, as various organizations working in the space of SRHR, we also have to come together and take stock of what are we doing, what are we lacking, and how best can we continue the conversation. Yes.
Yeah, thank you so much. And from just listening to you, there's a lot of work that individual feminists are doing, which are bold, which are resistant to the structural injustices that have exposed women and girls to vulnerabilities for, quite a period of time. And it's really just important for us to first acknowledge that we are struggling. Yes, there's these issues, there's these challenges, but also we have inherent power within ourselves to be able to infuse the changes that we would like to see. And we've seen a lot of, bold actions from feminists, both individuals and, at an organizational level. And we've seen, people, risk their lives to demand for access to services, go to the streets, carry placards, and ensure that we continue to, we continue to speak out, we continue to cry, wail, hold each other in solidarity when need be, for us to get to a point where sexual reproductive health and rights is a human right, and we can be able to boldly, claim that. So in terms of bold initiatives or bold actions, in something that you have seen or something that has stuck out for you in terms of organizing, that you can say that this one thing is definitely really bold that feminist movements have continued to do or that are planning to do, which is extremely revolutionary and can transform sexual reproductive health and rights. Do you, from, your work or from the work that you're doing, or just you even, yourself, if just anything that is bold, that is revolutionary, that will change the course of sexual reproductive health and rights, that you see or that you envision coming up. Is there something like that you can share?
One that comes in mind, and I think besides just the advocacy around access to safe and legal abortion, one thing I think I can really account or rather just spotlight is the movement towards the LGBTQI. And this one, I think it's something that has taken a very turn, especially in Africa. We have seen several countries that have really come out to see that this is an issue that needs protection and it's a human right, and the persons within this community they deserve dignity. And we saw it in Mauritius, we saw it in Botswana. Yes, we have seen a negative reactions, especially in Uganda and, of course, Ghana and Nigeria. But for me, the bold stand that I can see, and of course, even in Kenya, when in 2023, when the Supreme Court affirmed the right to associate should not be limited based on your sexual orientation, for me, that I think it's a movement that really we can learn on in terms of how their strategies has been, despite understanding the African context and how we are in terms of religion, morality, and how we approach. So for me, that is one thing, of course, from a feminist perspective and from a feminist point of view, it's a movement that, of course, has revolutionized, especially looking at how the laws have been interpreted. We have also seen in Kenya some cases where persons are being arrested and being charged criminally for who they identify as. So maybe one I can just reflect beside that, and of course, is just the aspect of adolescent health. And how it has also taken place. I've mentioned Rwanda being a good example in what it has taken to just lower the age, because they've understood that this is a human rights issue, it's a health issue, it's a dignity issue in terms of how we can address it. So it's just more of us to re-strategize and look at how best we can apply our bold efforts. And of course, just working together. Because I think in working together, there's great results in it, and there's effort. And of course, we've seen in safe and legal abortion, that one is one thing that for me, I think I value most, because looking at from the JMM case, that was petition 266 of 2015 or thereabout, we have seen in terms of how the law has responded to it from the constitutional level to even we're having now policies that are addressing abortion as a health issue. So for me, it's just to reflect on, of course, the gains that have been made in various advocacy around sexual and reproductive health rights, and to understand, of course, these rights, they're not new rights, as we continuously say, but they're just rights affirming people, their dignity, their access to facility information, to enable them to have their autonomy to make informed decisions and choices. Yes,
absolutely. Thank you so much. And for me, I feel like I'm living in a very revolutionary time in terms of like the gains and how seeing Rwanda just being able to acknowledge that adolescents' rights also matters, and that, you know, they deserve to be able to access the highest attainable standards of health. And, you know, that just gives me so much hope. But then also within the movements here in Kenya, and how we, of course, the small wins with the reproductive health policy, the part around, of course, the others being denied but then the safe abortion, you know, at least you know, there's recognition around safe abortion. So for me, majorly is, you know, access to safe abortion in Kenya, and how, you know, we are not there yet, but then we are seeing conversations around abortion being at least we can have conversations around abortion being had within homes, within homesteads, within TikTok, within the digital media, and especially young people just taking it on and being like, you know, these are things that are happening. And that helps to reduce stigma, and it helps to save lives, literally. So it means that women and girls can actually at least live. So you know, I'm living in a time where I've seen a lot of work. A lot of feminists have done this work. And I'm experiencing this because there's a lot of actually just working on the shoulders of feminists that have done this work. So I couldn't have been, you know, more prouder to just be in this space, such as a time as this. And also with the work that, you know, legal feminists, people who, you know, do law, honestly, without legal frameworks, I have seen that it's difficult. There's of course narrative change, but then if the laws are not aligned, if the laws are not speaking to each other, if the laws are restrictive, women and girls will never be able to access these services. So law is very important. And the work that you're doing around just legal reforms to ensure access to sexual reproductive health and rights, especially access to safe abortion, is really important. It's really important. It means that you're literally just saving the lives of women and girls. So with that, I'd like for us to, you know, just sum up this conversation to speak about, in terms of the contribution of African feminists on or even just contextualizing it to Kenyan feminists, to the global feminist movement? How do you think the work of feminists across Africa aligns to global conversations, or just global organizing, global feminist organizing?
Looking, of course, at the regional and African and also Kenya feminist and how best we can contribute, of course, to the global conversation is to tell our stories.
Yeah.
And for me, I affirm that in a way that we are best protected, we are best strategized, we are best led when we tell our stories how we want our stories to be told.
Yeah.
Because when you look, for example, even if, and let me just mention what had happened, I think sometime this year when you had the African family values. If I was to dissect in terms of understanding what an African family value, you have to center what is the voice of the vulnerables. Are you looking at women? Are you looking at children? Are you looking at all persons in their diversity?
Yeah.
And how you're valuing family values. So for me, it's just to center and to, of course, continue the conversations of telling our stories and demanding that our rights not be homogeneously applied, but of course to have that intersectionality of understanding. What is it that really affects us in terms of our movement? And collective care is something that is also important, as you're also focusing in terms of just having that space in the global conversations and to ensure that even if at the UN level, at the CEDAW level, they're making, of course, recommendations, we are best to know how we can center them to our African problems, because our problems deserve our solutions. So for me, it's just to call out, of course, when you have those spaces, at times it might also be difficult to just have that forward thinking or that conversations of focusing in an African way. But I think the call is on us when we have this opportunity to engage with the international levels, even at the regional levels, is just to keep that conversations and telling our stories how we best want to tell our stories. When it comes to the impact of safe abortion, I know we have talked quite extensively about it, but we just have to demonstrate how it impacts even at the level of the economy, the GDP, how that one affects. Because if one woman undergoes unsafe abortion and they go now to the public hospitals, you'll tend to see that a lot of money, or rather resources will be used to just support this woman. So we have to look at it in an intersectional way so that when we are looking towards global solutions that also come down to now the African level, to the Kenyan level, to the community level, that we are able to center this person in those conversations and not just provide solutions that are really homogeneous and they don't really address the problem. Because a lot of times we tend to see that poverty is something that is really a problem to many issues that are affecting women, girls, children, boys, men, and all persons in their diversity. So if we have a solution to address it all, let us embrace the stories of this person in that conversation and we center them in all those conversations. And for feminists, of course, is just to build on that solidarity. When we go to such spaces, when the anti-rights are coming, we just have that one story that we tell, that all persons deserve their rights, we deserve dignity, and deserve equal protection of the law. No one should be excluded on the basis of how they identify or how they perceive them to be as they are.
Yeah.
Yes.
Thank you. Thank you so much. And really, I think from the sharing or the conversation that we've had the whole time, I've just seen the work that we are doing, the work that African feminists are doing. So one thing that is important is that if the work makes sense to us, then it does not have to make sense to anyone else. But then I also acknowledge that African feminists battle with, a lot of societal injustices, the layers of vulnerabilities compared to feminists probably within the global north. It's a bit different. So it means that also our struggle is very different. The challenges that we're facing are very different. The way we show up within this space could be very different. It could be more difficult. So it means that there's, a lot of what you've mentioned around collective care. There's need for collective care. There's need for holding each other in solidarity. There's need for support. There's need for us to just acknowledge that what we bring forth into this space is heavier. And in doing so, then we are able to appreciate the work that you're doing. We're able to appreciate our contribution to our struggles, because our struggles shape the kind of people we are and how we also show up for this work. So I think as we close, probably the last question. This is a fun one.
Okay.
So if you had an opportunity to relive your feminism, how would that look like?
To relive.
Yes, to just be born a feminist again, or to be born like afresh. So you just you know about feminist ethics, feminist praxis, and now it's your turn to now live it afresh. How would that look like?
That's difficult, because for me, I think I don't think I'd change anything. I'd still continue with the stand that I do have. Maybe I don't think I'll relive it any better, because from where I'm sitting, I think I can say it's enough, because I'm both in terms of passionate just to change the law, looking at it in terms of just advocating for dignity for all persons, even despite the backlash, like I'm still firm in it. So for me, I think maybe one thing I can just see is just to influence everyone around me to understand the journey better, or to understand the movement better. So at least now to reduce, of course, the backlash of people not understanding why we are doing it and the end goal towards it. So for me, just to respond to that, I think if I'm reborn again a feminist and given an opportunity to relive better, I think I'll still just come back to my quote and say, no, I'm picking it up from where I left it.
That's nice. That's really, really nice. That's interesting. I don't know myself if I were to be born into this feminist work again. I think one thing I would want to just of course, yes. It's something that I'm doing right now. But also I feel like I should have started earlier, just looking at African histories, how colonialism, neocolonialism, capitalist systems affect African women and African girls. Looking at commodities, how, they're whether or not they're designed for African women. So probably I would, if I had more time, maybe I'll have more time to go into med school, to, look at our indigenous medicines, things like that, so that I can understand why do we need sexual reproductive health and rights that are not ours, and why our body is so dependent on it that we do not actually know what works for us as African women and girls. So I think for me, it's just that part. But the rest of the other things, I think I'm having the time of my life within this movement. It's not, of course, not enjoying, but I am. Yes, I'm where I'm supposed to be. I am influencing spaces where I'm supposed to be. I am amplifying voices. I am questioning. I'm decentering patriarchy. I am just ensuring that I am firm and my feminist ethics and praxis continue to grow depth every single day. So I think as I grow older, I become even bolder, fiercer, wiser. And I just can't wait to see what this feminist movement has in store for.
But just to add, and I think one thing we also have to affirm for ourselves as feminists, it's a journey. And like when traveling also to the using the road or any forms of transport, you encounter so many things. You can encounter smooth rides. At times you can get somewhere the vehicle gets a puncture, so you'll have to wait and it has to be changed. So I think it's just for us to just embrace it's a journey and to just be prepared. When you get that puncture, what do you do? Do you stop driving, or do you stop and change and continue with the journey? Yes.
Oh, clock it. Okay. My wisdom. Thank you so much, though. So I think we have come to the end of our conversation. It has been short, but it has been really enlightening. It is always amazing to have you in these conversations, in whatever feminist space, and you're there. It's just always a space where I know I'll learn something. I will get out of there better because you're smart as fuck. You're so smart. You're amazing.
Thank you.
And thank you so much for taking your time to, just be part of this conversation. And with that said, Thank you so much, our viewers, and we'll see you in the next one. Bye.
You're listening to Tusemezane Sasa podcast that is brought to you by Zamara Foundation, a feminist organization working towards reproductive justice. This space is going to be a space where we're going to have life-changing conversations around sex and sexuality and also the struggles of women. We're going to celebrate wins, but we're also going to talk about conversations that are deemed impossible, conversations around how the rise of anti-gender, anti-feminist, anti-nonsense groups that have come together to be able to bash issues around sexual reproductive health and rights. Welcome to this and join us in this journey of these life-changing conversations. I'm your host, Wamboi Kimani, and together with my other colleagues, I will bring you these conversations with Martha Kombe and Nancy Baraza. Welcome and keep listening and join us.
So buckle up, folks. It might be a little spicy, but we promise you a really exciting journey. Either way, it's going to be a vibe.
In this season, we are bringing you 10 powerful episodes where we'll be talking about feminist twins, feminist struggles, and the fight for sexual reproductive health and rights. In this season, we are going to unpack misinformation and disinformation while amplifying the intergenerational feminist leadership and feminist twins as well. So join us as we make the voices of African women and girls be heard through Tusemezane Sasa podcast.